The entire conversation about abortion is changing. And one of the reasons that it's changing is because of the abortion pill. And because it's not the same as going to a clinic anymore, there is an entire difference in how abortions are being done, how abortions are being promoted. And there have been some good news coming out of the courts. Here to talk with me about this is Eric Baptist. He's from Alliance Defending Freedom. And there's been a recent great decision just last week. A unanimous panel for the United States Fifth Circuit Court ruled against the FDA on this. And Eric's going to explain that to us. Welcome to the program, Eric.
Thank you for having me.
Hey, great to have you. You're with Alliance Defending Freedom, and you are involved, your organization is involved in this court. Have you been a part of these arguments specifically?
I have, yes, since the beginning.
Yeah. So tell us what's happening with the abortion pill, mifepristone, I think is what it's called, or mifepristone. And there have been a few decisions. See, and this changes things with the different states having different rules about abortions, limitations, 15 weeks, 6 weeks, no abortions, different things. It's an entirely different conversation if the pills can be mailed over state lines. And so describe this issue to us.
Yeah, and before I worked on this case, I didn't even know all the facts behind it because I still do. I go pray outside of the local abortion facility and think the brick and mortar abortion facility is what most people do. In reality, over 50%, maybe even 60% of all abortions are committed by chemical means, and largely within the homes, dorm rooms, or bathrooms of women across this country. It's
Did you say 60% now?
60,
60%.
correct.
Yeah, that's huge. People need to understand that.
And so what last year when the Supreme Court issued its Dobbs decision overturning Roe v. Wade, one of the things it said was the promise of Dobbs was to return the issue of abortion back to the people and their elected representatives. But ever since the Dobbs decision, the Biden administration in particular has sought to undermine those states and those people who have decided to protect life and women who are harmed by abortion by mailing these drugs across state lines to states where these restrictions and protections reside. And so the promise of Dobbs cannot be fulfilled unless the abortion pill or chemical abortion drugs are taken off the marketplace or basic protections are put back into place that the Biden administration in particular have removed.
We had a guest on a while ago who was an OBGYN who was describing what this pill does and the difficulties that women actually have. It's not communicated. It's another thing where the dangerous side to this and then what actually happens to your body, what you have to go through after. It's not just you take a pill and forget about it. It is a traumatic thing that's going to happen to women when they take this pill. So there's multiple issues here. And the Biden administration, in response to the Dobbs decision, has worked hard to promote the use of this pill over state lines, but no one's talking about the danger of it.
Correct. It's a two-drug regimen. The first one, as you said, is mifepristone. That essentially ends the unborn life inside the mother. The second one is misoprostol, and that induces labor and delivery of the baby from the mother. And so what happens is, because the Biden administration says you no longer have to see a doctor, you never have to have an in-person visit to determine you have any complications, and you can do this from, they say, the comfort of your own home, but really it's not the safety of your own home. It's not within the safety of a medical facility. It's doing it by yourself. So when women go through this horrific incident where they have this baby, they induce miscarriage and an abortion at home, we have stories upon stories where women are just horrified by what they see once the baby comes out of them. They have been lied to. They didn't realize what they were doing to themselves and to their unborn baby.
When we talk about this drug itself, there was an erroneous report on CNN that said that the complications with this drug are the same as complications with Tylenol, which is completely false. And this case revolves a lot around the FDA and their decision to allow this pill to be distributed. What did the FDA do wrong in their evaluation of this medicine?
Well, I will answer that with a rhetorical question. What did they do right?
Right.
Because from the beginning, what the FDA had to do, they decided to fast track approve this during the Clinton administration. But to use the fast track authority, the FDA had to call pregnancy an illness, which we all know is patently untrue.
I didn't know that part.
Yeah, and so this is part of our lawsuit. We said, well, they used the wrong approval pathway, and by doing so, they had to call pregnancy an illness. And one of the judges of our court from last week asked the FDA's attorneys, the U.S. Department of Justice, and said, because when we had oral argument in front of the court, it's right after Mother's Day, they said, did we celebrate an illness on Mother's Day? because he was like, how can the FDA with a straight face call pregnancy an illness? But that's exactly what the FDA had to do. They were supposed to study the effects of this drug on teenage girls because there's a law and a rule that requires that. They waived that requirement. So again, we don't know the short-term or long-term impacts of girls who get this drug. And frankly, there's no age minimum to this drug. So anybody can get this drug without parental consent, without knowledge. And that is what's happened across the United States. And a basic requirement of the FDA by Congress when they delegated this authority to the FDA is when you have a drug and you approve it, based on this labeled use and its instructions, you should have safety tests that show that the drug is safe and effective for the use on the label. One thing the FDA has never done in its 22 years of this drug is studied the actual labeled use of this drug. They always have additional protections, such as an ultrasound, when they conduct these studies. But what we know is there's never been a requirement to conduct an ultrasound to identify life-threatening ectopic pregnancies or to even determine gestational age, because the FDA once said it was up to 7 weeks, now it's to 10 weeks. As the baby gets older, more complications are likely to occur, and they just have refused to do anything about it.
This is a huge scandal, scientifically. We're living in an age when we don't trust our institutions anyway. And, every time I see a drug advertised on TV, it tells me how great it's going to be for me. But then there's the fine print and the guy who talks really fast at the end. He says, don't use this if you like to live in the daytime. Don't do all this. It's going to cause all these things. It's going to cause diarrhea and sore joints or death. They have to put that in there, right? But they're not doing that so much with this drug. Is that correct?
Well, they are not even tracking the complications, so
Right.
It's very unfortunate. But one thing the FDA has never done is required emergency room doctors or doctors who actually treat women for these complications to report these adverse events. But the one thing in 2016 that the end of the Obama administration that they required or took away was not reporting any non-fatal complications. So a woman could go to the emergency room, have to be resuscitated twice, almost bleed out to death, and the FDA says we don't want to know about that complication. And then during the Biden administration says, well, we're not getting a lot of information on complications, so we think this is going to be okay, and we can remove the requirement to at least have an in-person visit, and you can just have this done by mail. And the courts have repeatedly now struck down the FDA's decisions based on such flawed data reporting.
You're listening to the Pastor Scott Show, and is it Eric Baptist or is it Baptiste? How do I say it? I'm saying it right?
It's Baptist, just like the church.
Just like the church. All right, Eric Baptist, and from Alliance Defending Freedom. He is senior counsel there, and he's working on a case that has been working through the courts on the abortion pill and the FDA that has not, in a genuine or scientific way, approved this drug in any way that is any good. So where is it at in the courts now, and what is the next step here?
Well, we wanted the district court and all of our claims to take the drug off the marketplace because the approval was illegal, because pregnancy is not an illness.
So does that mean it's completely off the marketplace now? You can't get it?
No, there was, unfortunately, in April, the Supreme Court hit the pause button on our victories.
That's right.
One could argue that we were winning too much too quickly after 22 years of having this drug on the marketplace. The Supreme Court hit the pause button and says, let's go through the normal appeals process. So just last week, we won on the Court of Appeals, striking out the Obama era and Biden era changes to this regimen, which were highly dangerous to women and girls who take this drug. And now the Biden administration says they're going to take this on appeal to the U.S. Supreme Court. They typically have 90 days, so maybe by November we'll see an appeal to the U.S. Supreme Court by the Biden administration on this.
So that is coming soon. How do you feel about it? I mean, do you feel like that the courts are definitely seeing your argument here and the safety concerns that should be real with any medication?
Yeah, and frankly, this is so egregious. Some people talk about the broader implications for FDA drug approvals. I'm not aware of anything so egregious that the FDA has done in any other context with drugs, but because it's an abortion, sometimes we call it the abortion distortion, where the rules are bent and corners are cut by federal agencies. And here, that's what we're seeing with the FDA. But I think there's a healthy skepticism by the U.S. Supreme Court these days of federal agency action or overreach, failing to follow the rules that they're supposed to comply with. And so I think I'm hopefully confident and prayerfully hopeful that we will succeed at the Supreme Court. But I always ask for people's prayers and support along the way.
This is it's a serious crisis, I think, in the big picture, that the organizations that we have that are there to protect us. And I know a lot of people in the pharmaceutical industry who have worked very hard for years on certain drugs, and they have some pretty good results, and they start to submit to the FDA, and they get shot down. Right? It happens a lot. There's a lot of scrutiny that normally happens, but it sounds like on these political issues with this, I think some people have some questions about, ultimately what's going to happen about the COVID vaccines and some other stuff. This is something that is dangerous, not just to people's health, but also to people's confidence in what the FDA is doing.
That's right. And the FDA says, well, this lawsuit's undermined the confidence from the American people in their drug approvals. I said, well, FDA, you did it to yourself. It takes one bad decision to undermine every good thing that you've done in theory. And so, make amends and pull back this drug approval. Take this drug back off the marketplace. You've done that for other drugs where the FDA has made mistakes. But here they refuse to because it's highly politicized. The division which reviews the abortion drug, highly politicized. And so sometimes you just need the courts to step in when they overstep their legal bounds.
When the FDA considers, in order to move forward in this way, they consider pregnancy to be an illness, and they classify it that way. It's a way around the system, but it's not real. Do you have any sense, and maybe this is a little bit outside the scope of what your work is here, but any sense of actual scientists objecting to this? I mean, are there people who come to you and say, hey, I worked on this, and I'm part of this, and maybe I'm at the FDA. This is wrong.
We don't have any actual FDA whistleblowers,
Yeah.
but we do have doctors from across this country. Our clients in this case are emergency room doctors, frontline doctors, who have seen the harms that these drugs have caused. They have women who come in who need blood transfusions, who need to be resuscitated. They have heard stories of women who've died. They have had to save so many women's lives because of this drug. So they see firsthand. They don't need to conduct the studies to see what the damage these drugs do. But at the same time, there is some research out there that our allies have collected and looked at the publicly available information that show that the complication rates can be significantly high.
Yeah. And, for people who are listening in here, it's something that you've got to understand is when things get so politically charged and there is some advocacy going on for an issue and not the science of it. The people who hurt are the women who take these pills, who think there's nothing to it, who thinks I'm going to be fine, and it's a crime. It is an atrocity. I think maybe that's not too big of a word actually on there. Eric, as far as other things in the legal world of abortion after Dobbs, what are some other things that people should be praying for with ADF and similar organizations that are fighting for these women and fighting for these unborn children? What's next? What's coming up next?
Well, there's so many new battlefronts after the Dobbs decision. There's as everybody knows, within the states, there are various challenges or trying to attempts to change state constitutions, and that's very important. At ADF, I work on kind of what I call the Biden Accountability Project, because the Biden administration, more than any other previous Democratic administration, has focused on abortion, making it their top priority to put it out as much as possible. And so there have been a lot of bad decisions. We're trying to force pharmacies to stock and distribute chemical abortion drugs. We've challenged that in court. They try to force emergency room doctors to complete elective abortions. We challenged that in court and succeeded. Now that's on appeal as well. So I think there are many fronts that are next here. I think the states will play an important role, and also holding the federal government, in particular the Biden administration, in check will be very important in the next year.
I think people may not understand how behind the scenes the Biden administration has been so incredibly aggressive on this issue. It used to be, even Democrats used to say safe, legal, and rare, was kind of the idea. But it seems like we just want our abortions more and more often.
Yeah, people are probably look back at the Clinton administration as more of a pro-life administration than the current state of affairs these days.
That's an incredible statement, but probably true, right? Safe, legal, and rare. That was the idea, but that has definitely changed, and people need to understand that as we come into a presidential election and like you said, statewide elections where people are. We just lost one in California where we changed the Constitution that would open up the door to abortions happening all the way up through 9 months without any question, and also even the potential of allowing doctors to let children die even after birth. It's a terrible thing that is going on around the country today.
Indeed.
Yeah. Eric Baptist from Alliance Defending Freedom, how can people best help you and reach you? We want to pray for you and pray for ADF and other organizations working on this. What's the best way people can reach you?
I always recommend people go to our website, adflegal.org. You can learn more about our case. It's called Alliance for Hippocratic Medicine versus the FDA, and our other lawsuits challenging the Biden administration, defending religious liberty and freedom of speech. We do a lot of good work out there, so we appreciate your prayers and support along the way.
All right, Eric Baptist, thanks for joining me today on the Pastor Scott Show.
Thank you.
All right, God bless you and everything that you do.